Matthew Holt, TCB Update with Andy Chu. Andy is the SVP of Product and Technology at Providence, which is I'll have him tell us about it, but it's a very large health system. I used to joke, it's a small hospital in Seattle, but more than that. Andy, first off, tell us a bit about Providence. Just give me a sense of the scale of the organization.
Yeah, hi Matt and friends. So yeah, Providence, we are mainly on the West Coast, 7 states, 51 hospitals, over 1,000 clinics, over 120,000 caregivers. We do, 26 some odd $billion in revenue, serving about 5 million patients every year.
All right, very large West Coast health system. You've got people in Texas as well I know. But somewhat unusual, not unusually, but certainly you guys have been on the leading cutting edge in the bit that the organization that you work in, you're kind of doing new stuff. Several companies have come out of Providence. There's obviously been a little bit of interaction over the years with the folks coming backwards and forwards from Amazon. There's that whole sort of technology piece. Just explain what the innovation group that you work in does.
Yeah, so our model essentially is we like to live in the problems of healthcare, which there are a lot of problems.
I've heard.
And we try to, rather than trying to build point solution, we try to build platforms, actually solve multiple problems in healthcare. And so, for example, we announced a company called Praia Health, focusing on patient identity engagement. And essentially enabling, as a health system, we can do personalization. We can bring multiple assets to our patients in a cohesive manner. And then before that, we spun out a company called Dexcare, focusing on essentially access optimization. And then before that, we had a company called Xealth, and then before that, Wildlfower. So we have done this 4 times, and we're using Providence as a very large health system to essentially is a great test bed for us to test concepts. And once we can scale and understand the complexity of the issues on hand, then we bring on a management team. We help the CEO to raise money, and then we bring on external venture capital dollars. And then from that, we become a customer of those products, and then we spin them out.
So if you take someone like Xealth, right, who are probably, I think when they started, they had like 4 or 5 instances of Epic just within Providence, right?
That's right.
So that was tough enough. And they're a company which we know well, which does, which essentially surfaces and allows physicians to prescribe essentially digital interventions and a bunch of stuff like that. They're now in what? 15, 20 health systems. They're in services, so they're now out there doing their thing.
Yep.
What's the relationship? Do they come back to you for other stuff, or are you kind of the baby's gone out the door and gone to college and they're on their own? How does it work?
Yeah, they're on their own. They are they're adults out of the house. They don't come back.
Okay.
So we basically become a customer. We have usually have a board seat but non-voting. And then we purposely actually dilute our shares over time because we want to let the capital market, we want to let the management team really own the asset and run with it.
So any of their problems are now their fault. Okay, so let's go back to the start. So now, you have a problem, something comes up. How does that surface to be from one of the many things that you look at that come in the door? Because you guys are looking externally as well, obviously, to the actual thing. This is the thing we're going to do. We're going to fix this problem, and we've seen it enough times that we want to do it. So how does that work?
Yeah. It's a combination of art and science. There's no one prescription exactly what path we follow. We do a lot of research. From a research standpoint, we talk to operators, we talk to clinicians. And when we talk about operator, we're not only talking about senior executives, right, VP and above. We're actually talking to the frontline caregivers. We're talking to receptionists. We're talking to the financial counselors. So by doing these research, and of course our patients as well, we're starting seeing certain patterns, right? And then we also talk to the venture communities. We talk to the ISV community to see what's out there. And of course, we also talk to other health systems and to see if that's actually a problem that we're seeing, does it resonate with them? And how are they solving those problems? So when we distill down, then we say, hey, if we're going to go invest in this area, why should we do it? Or someone from a very well-backed VC company, they can do it outside of the health system. So we actually have to weigh that as well. by putting all that information into a blender, so to speak, and then we come up with, okay, there might be 5 to 10 thesis ideas that we want to go work on. And then from there, we do more research. And then from there, okay, we're going to work on 1 or 2 or 3 things. And then typically when we start looking at those is we want to tie a specific business metric to some of the problems that we're seeing. The other thing we also want to look at is available technologies, right? There might be some really complicated problem, but it's the technology there to actually solve that problem as well. So and then we start prototype, typically 1, 2, 3 people at the most, and we'll develop a prototype typically with an operator, and then from there we try to scale.
Okay, so let's flip it around. What's the alternative? So now I'm a small company, which I have perceived a problem, I perceive a solution to a problem that Providence might have. What's the role of your organization, or how do people get into Providence, around this? Let's say it's something you think you've seen elsewhere or you've seen outside.
Yeah, I mean, there are different ways, right? If obviously sometimes at trade show like this, right, people come approach me and we'll see, hey, if this is actually an interesting problem or not. And if it sounds like an interesting problem, we'll try to help the startup to bridge to an operator group, right? To see if it actually resonate with them. Oftentimes the problems do not resonate with the operators. And then there are times that they are like, hey, this is actually really interesting. And then they bring on additional folks. At that point, my team don't really get involved.
Okay.
So it's just, it really depends. I think it's important for startup to really understand. They need to understand exactly what problem they're trying to solve for. Is it a problem that health system like ours can actually resonate? And then 2, if they already have deployments, show the business case, show the return. Most health systems we're losing money, right? We're not a very profitable business. So we also have to articulate what not only the problem you're solving for, what returns we can get, and why you versus some other companies. So it sounds very basic, but a lot of companies still don't
figure out how to do that, of course. Real quick, Providence has a ventures group which has made a bunch of investments over the years, some in yours and some in elsewhere. Is there what's the relationship like that, between your group, the overall organization, the venture group? If they say we put money in XYZ company, does it get a better look, or is that fairly independent?
It's actually very independent. So Providence Venture and us, we operate independently. You hear more announcement coming up with the Praia Health over the next month or so. You have more information. So yeah, we operate very independently.
All right. Well, let's say last question, big picture, right? Huge hospital system. We've talked a lot about the transition to value-based care. It's going slowly. You mentioned that. If you look just now at the Change Healthcare hack and what's going clean, we're still in basically a fee-for-service system that's doing kind of what it did. What's your sense? You've been in a Providence a couple of years now. What's your sense about the level of progress that kind of innovation groups like yours are helping, are having on the massive system out there? When you've got the ocean liner and you're kind of the speed tugboat or whatever, I don't know what the analogy is.
Yeah.
How big an impact are all these innovation groups? You're one of the most advanced ones that we see across health systems. How big an impact are they having? Stop sighing.
That's a great question. I think it's hard, right? I think transition to value-based care, a big part of it has to align on incentives.
Sure.
Right? Between employers, providers, doctors, and payers. And healthcare is massive. We're almost 20% of GDP. So I think while we're making impact, we're not seeing as big of an impact as we would like, right? But I think it's also important to note, even if we can move like a couple percentage points, it's massive, right? So I think that's what gives me hope in terms of we need to get there someday, right? But we need to just keep working on it.
All right, last question. Can't avoid talking about it because I just saw John Hoanka from Mayo talking about it, and everyone else in the room is talking about it. When we talk about the use of generative AI or AI as a whole, how do you think that's going to spread in health systems? Is that going to come through organizations like yours? Is that going to just be people on the ground picking it up. It's a bit like, when people talk about bring your own device, don't bring in the iPhone. Everyone's looking at it, talking about it. How do you think that gets done in a huge health system like yours? Or will it be centrally organized, or is it coming over the edges, or how do you think this is all going to play out?
I think it's going to be both. The way we have organized it is that about 9 months, 10 months ago, we have a centralized governance group. Within the governance group, we have 4 different areas of focus, including consumer, which I co-chair, clinical, back office, and our caregivers. And obviously, many different type of use cases. So we want to put together a governance framework on how people can deploy and utilize AI, specific around Gen AI. But at the same time, we don't want to slow down the innovation at the edges, right? So that's the governance structure that we have put in place. In the meantime, we're also going through an active process in which we're vetting internal solutions, as well as working with vendors, right? So this space is evolving very, very quickly. And then the other things that we have done, specific my group, is we have put together a lot of our ML ops infrastructure from a process and technology standpoint to make sure that we are putting the right guardrails in place. We're monitoring this stuff in real time, and not only using machine, but also using human audit, right? Human in the loop is super important. It was important in AI. It's super even more important in the Gen AI space. So I think it's a combination of having a framework, centralized committee, providing direction, but you have to let the innovation kind of happen at the edges. So that's the approach that we are taking.
All right, I think it's fascinating, and it's one of these things where clearly you can't quite tell where it's going to happen. It's not going to be the old central directive rule buying Epic or whatever that it was, there was a couple of decades ago, and how it plays out and how people get smart at different departments. I went to a fascinating talk by John Hyamker at Mayo about this, and clearly there's a lot of really interesting stuff inside the health systems, outside the health systems, and
yes.
Hopefully, fingers crossed, it plays out to actually improve care and maybe lower some costs, as you mentioned.
Yes.
That's a big hope. We'll see how it goes. All right, I've been talking with Andy Chu. He's the SVP of Product and Technology and the Incubation Group at Providence. Thanks, Andy.
Thank you.